their problems and other issues. They are made from various distances in and out of Bangalore to be here. And from our department, our very, very sincere thanks to them to be part of this function. That would be my first statement. Second thing, I would be talking very briefly on the synopsis of our department, what we are, what we have done till now, and what we plan to do in future, which I should express before I talk. One is definitely from the chairman who has been responsible for setting up this excellent cancer center, being the cornerstone behind whatever we have been doing. We have been interacting with her, sharing our plans and getting approvals from her, and going ahead in our duties towards the patients. So without this support, it would have been impossible for us to be in any stage of planning the part of our future. Secondly, and most importantly, if we could do something meaningful till the age-wise rather than the position-wise, I would sincerely thank each and every one of the colleagues of my department who have been wholesome in their support towards the development. There have been no full stops or no ifs and buts when it comes to supporting the cause of working in the department. I would say, I have been in various institutes. This would be my best as far as the team effort goes. Everybody has been supportive and a big support for that. Now, let me just run through what we are, what we have done till now, and wind up my speech. The radiation oncology wing, Dr. Geeta and Soumya Narayan were the ones who were the pillars when starting this institute. They were there from the first laying of brick here. They have been instrumental in getting everything ready. We all joined later actually. That was the starting phase. It started with the installation of image-guided radiation. It was the first in the Asia, the best vicinity. The linear activator of the external radiation is given from a distance. The HDR-Vydehi is mainly used to treat cervical cancer patients. We see quite a lot of cancers of the cervix, which is the commonest cancer in females of India. We have a tie-up with a rural hospital, a mission hospital, which regularly sends us patients, and these patients are essentially benefited by making use of a combination of external as well as a brachytherapy. A fallout of the type of patients are treated. Roughly 50% of patients are treated with a type of technique called 3D CRT and intensity modulated radiation therapy. 20% of them right now require the facility of image-guided radiation, especially tumors like the lung, the prostate, and the moving organs. 4 to 5 patients have been treated in the past 2 months. We have started around 2 months back and likely to go up in future. The department has been treating cases referred from Vydehi Institute and other areas, especially the neurosurgical cases who undergo surgery there and come down here for radiation. And the department has been quite successful in treating some of the complicated pediatric medulloblastomas, which requires a very critical planning and delivery, especially the patients being children and the tumor being at a very vital age. Come down surgical oncology, my area. I started at one. We added few more, last few, and we have cut down now 2 consultants. Started 3 years back. We have crossed around roughly 1,000.
The lifestyle diseases, that is cardiac and carcinoma, were very rarely brought. Today we have amazing incidence of cancer and cardiac problems. Youngsters, 24-year-old youngsters, 30 years old. You have 14 lakh cases in the country per annum being detected. Those days, in the 60s, there used to be cobalt machines, which gave treatment not only to the tumor, but all cells around it. Today we have linear activators, which are IMRT, IGRT, and recently the least amount of dosage and the fastest treatment. I have seen cases, especially for men, related to tobacco, chewing of tobacco and cigarettes, that is oral cavity, esophagus, lungs, and those related to alcohol. I have seen liver and pancreas cancers. For women, I have seen cervix cancer and breast cancer. Amazing rise. The oncologist who used to come in the morning would have one case. The afternoon oncologist never saw anyone. Today, the two oncologists in Maria Hospital have at least 8 to 10 patients waiting.
We are very pleased to have Professor T.S.Ganesan amongst us. Professor Ganesan has come on I've had the good fortune of working with him for a brief period at Amrita Institute, where I worked as an assistant professor.
I did not work.
Completed his MBBS and MP in general medicine from JIPMER, Pondicherry, and thereafter moved to the United Kingdom. He did his membership of the Royal College of Physicians, UK, followed by a PhD in molecular biology. He is also a member of the National Academy of Medical Sciences, India. He specialized in training in medical oncology accredited by the Joint Committee on Higher Medical Training, UK, and worked as a senior registrar at St. Bartholomew's Hospital, Royal Hospital, London, and was a visiting fellow in medical oncology at Dana-Farber Cancer Institute, Boston, and Fox State.
Presentation, which has become mandatory. I prefer the long chalk and the blackboard, which actually gives you a more intimate view of things, just like a play and television or cinema. Nevertheless, now this is the mechanism by which we all have to speak to. Thank you very much, Yoga, for those kind words and inviting me to come to this institute, which I had not visited before. I'm very pleased to say several options. One, of course, was focused on cancer. In fact, I showed him all three PowerPoint presentations just now before I came up, focusing on cancer, because today is the World Cancer Day, and he was there when we celebrated it 2-3 years ago at Amrita soon after I joined, with an away day for patients. But then finally I decided I'd talk about this in consultation with him, because although all of you are medical students and different types of students, you all have good teachers, and teaching is done excellently, published in textbooks as well as in journals, and then presenting that to students. You are very good. I can vouch for that. It is also close to my heart, because without research, you will not have this beautiful institute today. You will be sitting in a small hut, probably prescribing some medicines or getting out blood. Research is the main difference between the modern system of medicine, which we call allopathy, versus the more ancient systems of medicine like Ayurveda and homeopathy, which depends on a slightly different approach. Being the World Cancer Day, it would be foolish not to actually mention a few words about what we have.
To hand over a memento to Dr. T.S.Ganesan.